Hi, everyone, and welcome back to Ostomy Care with Angel Face Amy. I'm so glad you decided to join us for the second episode, and today we're going to be talking about one of the most common concerns I hear from patients, preventing ostomy leaks. Leaks can be frustrating, uncomfortable, and even impact your confidence. The good news is that with the right knowledge and techniques, they can often be prevented. Leaks happen for a few reasons. One of them is poorly fitting ostomy barriers, moisture or irritated skin around the stoma, which we talked about last week with the skin crusting technique, high output or liquid stool consistency, and improper application of the appliance. So first, we're going to talk about making sure we get a proper fit with the appliance. So it's really important that you measure your stoma regularly, especially in the first few months after surgery, because stomas can change size and they can get less swollen, and using the right size barrier is key. So this is the barrier, and then this is an example of an ostomy measuring guide. They do make ones that are oval shapes. So if your ostomy is not a perfect circle like my fake little ostomy is, then we can get you an oval shaped measuring guide. So in this case, with this little stoma, we're going to try to find the one that fits over it the closest with having the least amount of exposed skin around it. So in this case, this little stoma would measure about 1¼ inch or 32 millimeters. So you would take your barrier and then you would look at the back and you'd find the numbers here, and you can see there's one line drawn for 1¼ inch right on the barrier. So you would take your scissors and you would cut along the 1¼ inch line here. We'll go ahead and do that, and I'll show you what a properly fitting barrier looks like. So you just go around and you cut on that line. And after a few weeks, if your stoma stops, shrinks and it's not changing size after 6 to 8 weeks, then you can order these barriers pre-cut to the right size. So in this case, you could order your barrier pre-cut to 1¼ inch. So I like to go around, make sure there's no sharp edges from the barrier to poke your stoma or your skin. And then if we had this on our stomach here, then this is how a properly fitting barrier. Okay, so that's a little bit too small. So we would go and we would just make it slightly bigger. So when something measures 1¼ inch, you actually want to make sure that you cut on the outside of the line. So we just go and make it slightly larger. That way it will fit right around the stoma. So now in this case, here's an example. You want as small amount of skin showing around the stoma as possible. Like up to 1/8 inch of skin around the stoma is okay, but you want enough protection around the stoma so that it's all fully protected and covered. That's how you're going to measure. And then you always want to make sure you clean the skin around your stoma. I always just say to use warm water. I'd say to avoid soaps and baby wipes and anything like that, because they have moisturizers and aloe and oils in them, which can hinder the adhesion of the barrier to the skin. So I would just clean the skin, the stoma and the skin with warm water. And then I would make sure that the skin is completely dry before you apply the barrier. Moisture can prevent the barrier from sticking. So you really want to make sure that there's no drips of stool and that you get it completely dry before you stick the new barrier on. And if like a drip of poop were to come out and get underneath the barrier, you'd really want to start back over, because that's going to hinder the sticking and then it could cause a leak in the future. So the other thing is you can use barrier rings or some kind of, they have Ekin seals to create a snug fit around the stoma to protect your skin. You only need those if you're having trouble with leakage. You can, or if you have a divot or other issues that might be going on that doesn't make it like a perfectly flat surface with a perfectly round sticking out well-butted stoma like this. in real life, it's usually not a perfect circle, it's oval, and then there's divots and folds and all kinds of things that cause problems with leaks. So barrier rings can help to fill in those dips and divots, and they can help to create a nice snug fit. So you would take the barrier ring and you can either put it on your skin directly before you put the new barrier on, or you can attach it to the back of the barrier and pinch it onto the around the edges of the barrier. So then when it's on there, it kind of becomes like a caulk, and it kind of gets in all those divots and creases to prevent any leaks. The other thing I was going to mention is that you can consider using an ostomy belt. You can only use ostomy belts with two-piece appliances, because the two-piece appliance has this on the back of it, these little holes here. This is where you hook the ostomy belt into place here, and that just gives you a little extra support for your appliance to kind of stay snug and up close to your skin. So that's how you would use an ostomy belt. So I get a lot of questions about leaks. So the first question I have here to address is, what if my barrier keeps peeling up at the edges? So that is what they're talking about, is here on the edges. This is a tape order. So I always say that the tape is really not the important part of the seal. The important part is the inner part here. This is like a wax ring around a toilet. This is where all the adhesion, really, all the work is being done here in the middle. So this is it's activated by heat and pressure. So I always say, after you put your barrier on, make sure you hold your hand over the appliance so the pressure and the heat from your body can help activate the adhesive. And I always tell people to sit there for at least a minute or more and just make sure they get a good seal before the poop starts coming out. So, but back to the tape. So if your tape starts peeling up on the edges, it's more annoying than anything, and it can kind of pull it off as you go about your day. So they do make, you could use tape to kind of help seal it around it, or they do make barrier strips that can be used to go over the edges and help hold the edges down. And the barrier strips are made out of that same material as the inside of they're like a hydrocolloid. So they kind of stick a little better than the tape in some cases, because everybody's skin is different. So yeah, I would try using some barrier strips or some tape around the edges to help holding it down if that becomes a problem. The next question I get is, can diet affect leaks? And the answer is definitely yes, because certain foods can cause more liquid output, which makes leaks more likely. So we really want the stool to be thickened up, and then it would be less likely to leak. So certain foods are going to make the output more watery and more liquidy, which is going to cause more leaks. It's also important that you need to drink plenty of water and eat soluble fiber. The fiber can help thicken up the poop, and it's important to not get dehydrated and make sure you drink enough. So yes, definitely your diet can affect leaks. And then the last question that I get often is, how long should my barrier last? Most barriers are designed to last 3 to 5 days, but that can vary based on your body and your output. So if you're having a lot of liquid output, or if you're more sweaty, maybe it's in the summer, those things can cause the barrier to last less days. It's always important that you're in control and it doesn't cause leaks when you're out and about and trying to do things. So you have to do what works best for you. So if you notice going 3 days seems like it's sticking on good after 3 days, maybe you push it to 4 days, or maybe you just continue without changing it every 3 days. You just have to do what's best for your body. Leaks can feel discouraging, but you're not alone. With practice and the right products, you can gain confidence in your ostomy care and routine. If you're struggling, reach out to your healthcare provider or your ostomy nurse for guidance. Thank you so much for tuning in to Ostomy Care with Angel Face Amy. Don't forget to like, subscribe, and leave your questions in the comments below. I'm here to support you every step of the way. Together, we can navigate this journey with confidence.